Afternoon, members. I call Committee of Supply Section C to order. We're meeting today to continue the consideration of the budget estimates of the Ministry of Labour. I recognize now the Minister to move the vote.
Thank you, Honourable Chair. Vote number 38, resolve that a sum not exceeding $25,407,000 be granted to His Majesty to defray the expenses of Ministry of Labour, Ministry of Operations to 31st of March 2025.
Thank you, and I understand that the Minister has a response to a question from the last sitting? No.
Actually, I believe
Perhaps
there's some information that the Minister and staff will look to assemble to provide for them today.
Minister.
Thank you. Member asked for how many claims were there relating to exposure at workplaces, and we gave them the total number 117. If I could break it down, 2019 there were 22, 2020 16, 2021 23, 2022 20, and 2023 36.
Member.
Thank you, Honourable Chair. There were some additional questions that I had posed yesterday towards the end of estimates. The Minister was going to make efforts to try and obtain additional information. One was the breakdown of how many actual complaints were received. I know the Minister had indicated that that was some work that they might have to do internally in order to determine how many complaints. We are aware, and the Minister did confirm that there were 36 claims that were actually submitted, but it was the number of complaints that we were looking for. In addition, I'd asked a question through Honourable Chair to the Minister about how many of the targeted inspections were actually undertaken across British Columbia. The Minister did give reference to specific work that was undertaken by WorkSafe BC on Vancouver Island, but I did not hear a number on how many of the targeted inspections were actually undertaken by WorkSafe BC. And then lastly, one of the other questions that was raised was for the compliance order, or the compliance agreement. Just looking for some clarification. Is there only one compliance agreement that would be issued for all work sites that might be on Vancouver Island Health Authority, or are there multiple compliance agreements? So just trying to get a bit better understanding. Is there a compliance agreement that would be site-specific, which would be issued for all of those different sites, and certainly not limiting the Minister's response to just Vancouver Island, but across BC? How many compliance agreements currently are in place with respect to healthcare workers' exposure to toxic drug chemicals?
Minister.
Thank you, Honorable Chair. So there were in 2023 in healthcare and social services. So it's covering a lot more than just healthcare. There were a total of 428, what they call them, initiating inspections. And as I'm advised that after the initiating inspection is conducted, there may be more after that to follow up, which resulted in about 498 orders. That's what the information we have.
Member.
Thank you very much, Honorable Chair. There was a number of questions that I had posed that I was still seeking answers for. That has to do with the compliance agreements. If the minister would be able to provide or shed any light on the number of compliance agreements that have been issued against or within any health authority, across the province, and then further that, if the minister is able to share, is that are those compliance agreements, can those be shared with this House? It was a question also that I'd asked just yesterday.
Minister.
There were a total of 4 compliance agreements in the province, and not necessarily, but it is compliance agreements are required to be posted at worksite and shared with the health and safety committees, and so they would be available there as well.
Member.
Thank you very much, Honourable Chair. The Minister had referenced that there was a number of targeted inspections that were undertaken at the various health authorities around the province. Is the Minister able to share how many of those targeted inspections were actually undertaken by WorkSafe BC? And in addition to that, I'm just wondering through your Honourable Chair to the Minister, if the Minister could share with us in the instance where the compliance agreements were entered into with the employer, I'm still just looking for some clarification. Is there only one compliance agreement that is put in place to cover all of the work sites that might be impacted across BC, or are these issued site-specific? And just in further to that, the Minister had referenced that there was 4 compliance agreements undertaken. I've got a copy of one. Is this the only one that was actually issued to the, with respect to the concerns raised in the various health authorities?
Minister.
Thank you, Honourable Chair. In this particular case, it covers the entire Vancouver Island Health Authority, one compliance agreement, and it has different timelines in there of compliance and from beginning to the end. So that's what the compliance agreement will give you the information. There are 3 others, I'm told, that's across the province, and we don't have them here, but I think individually they would be they would cover different areas. I guess each compliance agreement would be covering different areas. You know, it may not be exactly what that is, the one that I offered.
Member.
Thank you very much. Through your middle chair, just to the minister. This particular compliance agreement is the employer is identified as the Vancouver Island Health Authority. It indicates that the date of the initial inspection being June 12th of 2023. The progress date indicating June 12th of 2023. Can the minister provide any clarification with respect to have there been ongoing reporting from the employer or has there not been any further progress of updates since June 12th of last year?
Minister.
Thank you, Honourable Chair. So if the member would read through it from the beginning, which I think started in June, and it'll take you all the way to February 27, 2024, and that particular report says that there are 0 items outstanding. So it means the progress has been made and it was all completed.
Member.
Thank you very much, Honourable Chair. And the other 3 compliance agreements the minister has referenced, is the minister able to provide confirmation on which other entities or employers are related to those other 3 orders?
Minister. We have to follow that up with the critic because that wasn't asked yesterday. We can find out. Like I said, there are 3 others covering the entire province, so this staff have to go back and dig it up.
Member.
Thank you. With all due respect through you, Honourable Chair, to the minister, if the minister might be able to have staff maybe contact the office, if they could provide that even before the end of our exchange today, that would be much appreciated. The minister referenced 498 orders that were actually issued by WorkSafe BC. Is the minister able to share, with respect to those orders, it's my understanding, and I stand to be corrected, that orders typically would come with some kind of a financial penalty associated with it. If the minister could just confirm that my understanding is correct, and if that is the case, of those 498 orders, what is the magnitude, maybe the high and low end of the actual penalties that were assessed against employers? And if the minister might be able to direct me where I would find that information on those specific orders.
Minister.
Thank you, Honourable Chair. I'm advised that there was no penalties issued or arose out of those 498. Where the member can find them, those orders are posted at work sites and available to their local health and safety committees and employer, of course. And but there's no other mechanism to make it public.
Member.
Okay, thank you very much. Through your Honourable Chair to the Minister, I appreciate the Minister pointing out on the compliance agreement, the updated compliance progress report number 4, which shows a progress date of February 27th, 2024. The compliance agreement states, and I do appreciate the Minister sharing this with me, I'm just having a look at this now for the first time. It in part states that if at any time WorkSafe BC determines that the health and safety workers is at immediate risk or is no longer adequately protected by this compliance agreement, the agreement will be cancelled. The agreement will also be cancelled if employer intentionally provides false or misleading information in relationship to the agreement. Through your Honourable Chair to the Minister, with specific reference to the claim that if at any time WorkSafe BC determines the health and safety workers is no longer adequately protected by this compliance agreement, the agreement will be cancelled. Through your Honourable Chair to the Minister, does the Minister feel, in light of lots of the most recent allegations that have been raised and reporting of nurses being exposed to toxic drug chemicals after the February 24th or 27th date of this compliance agreement, would the Minister agree this compliance agreement should be cancelled and that additional work should be undertaken by the employer to make those proper safeguards to protect nursing and healthcare staff at BC's hospitals?
Minister.
Thank you, Honourable Chair. So this compliance order had its life, and it ended on, as I mentioned earlier, February of this year. And if the member look at on progress number 4, it lists all of the items that were identified and what the employer was able to complete to make sure that they are in compliance of this agreement and occupational health and safety compliance. So this agreement is over. If anything happens after, any complaints came to the WCB after, it'll start a new process. And but nothing will come out of this. This compliance agreement is complete and over.
Member.
Thank you, Honourable Chair. In light of the reporting of the various instances of drug exposure to healthcare workers at care facilities across the province, does the Minister feel, through Honourable Chair, does the Minister feel that it would be appropriate for WorkSafe BC to undertake further investigations to actually look into what would likely be reported as a workplace accident that would have happened subsequent to this compliance agreement being put in place, in order to reactivate their concerns on providing that necessary protection for healthcare workers in our province?
Minister.
Thank you, Honorable Chair. WCB, just like any complaint that comes to them about possible non-compliance through a complaint by a worker or anybody, they take those things seriously, and they initiate the investigations. And as I think canvassed yesterday, the orders are written or compliance orders are needed, then compliance agreements are signed. That's a normal process. And so if a member is asking for individual complaint coming to the WC, there are thousands of them every day, probably, and they take them seriously. And every complaint that comes to them, they take it seriously and put them in a process to ensure that if there's a complaint about non-compliant, or if some workers' health and safety is in danger, they take action. And perhaps since that compliance agreement has been completed, there could be healthcare and elsewhere. There will be probably many other processes going through right now.
Member.
Thank you, Honorable Chair. Yesterday, in the opening of the minister's remarks, the minister made a statement. He said to this House, "I want to make sure that the workplaces are the safest in the country here in our province." I think it's been evidenced by not just the number of complaints, but the number of actual targeted investigations, the workplace accident reporting that has been provided by impacted healthcare workers in the province, the compliance agreement that the WorkSafe BC office undertook with the Vancouver Island Health Authority, and the subsequent reoccurrence of worker exposure to toxic chemicals certainly paints a very different picture. A government that touts the need for providing protection from workers, that is not happening. And we are seeing nurses cry out for help, extremely concerned about the very dangerous situations that are presenting themselves in healthcare facilities across the province of BC. The challenge that we find ourselves in is that even should there be a need for security guards to intervene with some of these individuals, they don't have the right under the current legislation to even confiscate these harmful and toxic drugs that are being presented in our healthcare facilities around the province. There's no use calling the RCMP because this government, through a policy choice, has determined that it's actually okay for people to carry 2.5 grams of cocaine, fentanyl, or heroin. Honorable Chair, even an 18-year-old can get a minor in possession fine for having a beer or bringing a bottle of wine into a facility. That's not permissible. That can be dealt with. The alcohol can be confiscated. But harmful drugs that have the potential of killing British Columbians and putting healthcare workers at significant risk, the RCMP don't even have the legal right in this province to actually confiscate those drugs from individuals that are bringing them into the hospitals. We're seeing reporting of drug dealing going on within the St. Paul's Hospital. These are incredibly damaging events that are unfolding. And I was going to say allegations, but I think we're far past it's just being an allegation. There's verifiable proof. And when workers have the opportunity and they have the right to a healthy and safe work environment, the employer, which is the health authorities and largely government, is failing to provide the necessary protections and the safe work environment for healthcare professionals across the province. Through Honourable Chair, to the Minister, does the Minister believe that it is fair, just, and right, and in any way, shape, or form is providing workers that opportunity to have the safest workplaces in Canada when we are seeing the exact opposite play out across British Columbia at the detriment of the health and welfare of workers in BC?
Minister.
Thank you, Honourable Chair. I think the policy that the member is talking about, he voted for in the House. He did.
No, there's no votes.
Members, no crosstalk.
That party supported that policy. Now, of course, there are issues that are raised by our healthcare workers, and we take them seriously. Now, if the member is suggesting here that somehow someone with a broken leg who also is addicted, that 10 years ago, if they came to the hospital at that time, somehow were treated differently than today? Answer is no. You don't expect them to cold stop addiction because you're going through a treatment. That happened then, it's perhaps happening today. The rules are very clear. You cannot smoke in our health facilities. Does that mean that no one smokes? Whatever policy you may have, you had cases even before that, before we formed government, people smoking in washrooms in hospitals. So people break rules. You're not supposed to drive over certain speed on a highway. The people do. That doesn't mean there's somehow policy to accept people breaking the law. And this issue has been canvassed in the main chamber through question period for a number of days now, and the Minister of Health is very clear. They somehow try to score political points on beating up on some of the most vulnerable people in our society. I think we are a compassionate society. This is Canada, and those people with addiction, those people who are so vulnerable, they need support. At the same time, we support our workers. They also have the right and they deserve to work in a workplace that is safe. Anything less is not acceptable to anybody, not to their employer, not to WCB, certainly not to us. So, you deal with the situation every time there's unsafe conditions created naturally or otherwise by, it could be human caused, could be others reasons. There's a health and safety committees in place. Workers have a right to report to their health and safety committee. They have every right to go to their management supervisor and report the risk and the dangers to their health. And if they're not able to resolve locally, then they both can contact WCB. The WCB will come in and investigate, and they will apply the occupational health and safety regulations and the policies to ensure, number one, their consideration is the health and safety of the worker. And so somehow suggesting that this is acceptable by some policy that people can smoke drug, people can smoke cigarette in the hospitals, and that's not true. They're not allowed. And we have been canvassing, like I said, for a number of days now in the Major House, and I don't know what the member is doing here, repeating the same questions in this House.
Member.
Thank you very much, Honourable Chair. Look, the province is not providing a healthy or safe work environment for our healthcare workers across the province. That's been evidenced by the number of worker exposure to toxic and deadly drug chemicals. So that is playing out across the Healthcare Authority. A complaint, obviously, is what led to this initial compliance report being issued on June 12th of 2023. Government, or WorkSafe BC, appears to have concluded their work on February 27th of this year, indicating that the employer had made all necessary efforts in order to provide those necessary protections for workers. And yet we have evidence, as has been reported in the media from multiple channels, of ongoing worker exposure to deadly drug chemicals in our hospitals. So I would suggest, through your Honourable Chair, the work is certainly not concluded. Where a compliance agreement has been closed off by WorkSafe BC and further infractions are reported, through Honourable Chair to the Minister, can the Minister indicate, would it be the purview of WorkSafe BC to maybe undertake yet another or new replacement compliance agreement, or would there be a requirement at this point in time to actually go straight to an actual order?
Minister.
Thank you, Honorable Chair. The member make unfounded allegations, statements, as always, again today. He said the workplaces are not safer in British Columbia anymore. Wrong. All you have to do is go into, do some research, and you will find out that the injury rate in British Columbia is going down compared to when he was in government. 2014, time loss claims were 2.27 per 100. Today they're 2.10. Right through they're coming down. And serious injuries again. So, Madam Speaker, it's easy for a critic to stand up and make those statements. They're not true. And, I'm sure that he would agree with me that we want to make our workplaces safest in the country. That is the goal. That is what our intention is. And every workplace, their health and safety, the management, they also move towards that goal. Injury rate are going down. Is that acceptable? I mean, going down is a good thing, but even one injury is one too many. Some of the injuries leave some life-altering conditions for not only for the worker, for their families, their friends, and workplace. So a lot of people are working hard to make sure we make our workplaces safer. And the results are here. And so yes, there are complaints every day, ongoing complaints. And the member, if he goes back to 2014, 15, and 16, you can find evidence that people smoked in hospitals. They brought drugs into the hospitals. And, those are not allowed. They were not allowed then. They were not allowed now. But people do break rules. And you deal with them on an individual basis. But at the bottom line here, for me as a Minister of Labor and for our government, is to make sure that the workers who are working, that their health and safety is protected, is the number one priority. And I will never stop continuing on with that goal in my mind. Because workers have every right to go to work in the morning, come home at the end of their shift, safe and whole. That's what I think every member of this House like to see, including the critic. But throwing allegation for political convenience, I think, is not doing anyone any service.
Member.
Thank you, Honorable Chair. The reality is that nurses and healthcare workers do not feel safe in their workplace. They are coming forward out of sheer frustration, raising these alarm bells, both with their union representatives, as well as directly with government and with the media on the ongoing crisis that is posing significant harms to our nursing and healthcare staff across the province of BC. That is the reality. I'm not making any allegations with respect to worker safety in our healthcare services sector. Over the last 2 years, Honorable Chair, through the estimates process, asked specific questions about the significant increase in mental disorder claims, largely within the healthcare services sector. And healthcare claims, and I certainly would appreciate an update from the Minister today on what the 2023 reported incidents of mental disorder claims are in the province of BC. But over a 5-year run, claims cost associated, WorkSafe BC claims costs associated with mental disorder claims in the healthcare services sector rose from 38 million to 197 million, a 500% increase. And as was canvassed previously, I think most British Columbians would expect that over the course of COVID and the pandemic that we would have seen an increase. But that increase has continued to carry on and continue to escalate. And I think as I shared yesterday in some of my commentary, through Honourable Chair, to the Minister, the shortage of nursing capacity has resulted in an existing workforce having to work double shifts. You imagine working a 12-hour shift only to find out there was no replacement to come in for you and having to work a secondary 12-hour shift. That's put a significant burden on our nursing and healthcare staff. That has led to an increase in PTSD and mental disorder claims. The rampant drug use in our hospitals and healthcare sectors has caused significant harm to workers. It has largely led to a number of WorkSafe BC claims that have been evidenced. WorkSafe BC is familiar and aware of some of these significant concerns that have been brought forward by healthcare workers. And just because this compliance report was actually concluded on February 27th of this year, the incident and the concerns are continuing to be raised by healthcare services staff. This is not a problem that has been fixed or addressed, certainly not to the satisfaction of the healthcare workers operating in our province. So, Mr. Honourable Chair, I would appreciate an update from the Minister on what has happened with the case of mental disorder claims in 2023, both in those number of claims and what the total cost to WorkSafe BC has been. I'm certainly hoping that we've seen that number maybe come down from previous years, but I don't anticipate that that is the case. And just while I'm on my feet, I also wanted to raise one further question to the Minister, and this comes from WorkSafe BC year-end 2023 healthcare report, and it sets out the planned inspectional initiative by WorkSafe BC, indicating there was a targeted number of inspections of 492 with 438 inspections targeted. But it indicates year-to-date totals, indicating that there was 498 orders, but reflecting in 144 orders that had potential, it says with potential for high-risk violation. I'm just wondering if the Minister might be able to share some insight onto those 144 high-risk violations, if any of those were specific to healthcare facilities in the province of BC.
Minister.
Thank you, Honorable Chair. Members' second question of 498 and 428 inspections resulting in 498 orders and 144 he mentioned were of a high risk to cause injury. So the inspections are focused on the risk of workplace violence-related injuries, risk of overexertion, musculoskeletal injuries due to patient individual lifting. So there are certain areas, once they are identified, and that's when they're identified, and that's what those number 144, I think the member was looking at. Those could be some of the reasons that they come from those areas. Now, a member asked for how many psychological injury claims. I can give member the numbers. 2017, there were 3,229. Those are the reported claims. 2018, 3,641. 2019, 4,506. 2020, 4,438. 2021, 5,455. And 2022, 5,902. 2023 was 6,791. Now, remember, and all of us have to remember that before 2018, there was no presumption for psychological injuries. Mental health presumption came in. As a result, more and more claims were accepted. Now, those are the total numbers, and then claim cost for psychological injury claims were approximately $211 million in 2023. This compared with $197 million in 2022.
Member.
Thank you, Honourable Speaker. Well, it certainly doesn't appear that the incidence of injury or claims costs is going down. It seems to be escalating and increasing. An increase from $197 million. These are huge dollars that are impacting the cost of healthcare provision in this province. $197 million in 2022. $211 million. These are approved claim costs at WorkSafe BC and largely taxpayers having to pay out. And the incidence and frequency is increasing. It's not getting better. We haven't turned the corner. I'm sure that the minister will probably reply that there's maybe been an increase in staffing levels, but I don't know that necessarily should take away the extreme concern of the increasing incidence and the costs associated with mental disorder claims in the province of BC. Nurses that I have spoken to have pointed to the employer, indicating the employer is playing a part by not having sufficient staffing levels, nurses having to work multiple shifts, worker fatigue, burnout, stress, a volatile workplace. Nurses that I have spoken to have indicated that the employer, which goes all the way back to the government of British Columbia, are the ones, through their inability to have sufficient staffing levels, is leading to this increasing incidence of worker disorder claim. And in addition to that, we have nurses and healthcare professionals also extremely concerned about the increasing instance of dangerous and toxic drugs being smoked and consumed in our hospitals across British Columbia. It's incredibly concerning. Honourable Chair, I'm also looking to the new hazardous drug requirements. It's a WorkSafe BC initiative. Amendments to Part 6 of the Occupational Health and Safety Regulation. And this update from WorkSafe BC was published on November 14th of 2023. And the headline states, amendments to Part 6 of the Occupational Health and Safety Regulation come into effect on December 1st, 2023. The amendments reflect the current use of hazardous drugs and detail how employers can meet the requirements to eliminate or minimize worker exposure to hazardous drugs. You know, it's quite a lengthy, I'm only in receipt of what I believe is just the draft regulation. But Madam Chair, it is extensive as far as additional initiatives and expanded initiatives and responsibilities of employers. As I referenced, this WorkSafe BC directive published on November 14th indicated that these regulations will come into effect on December 1st of 2023. Through your Honourable Chair, can the Minister confirm that those amendments have indeed actually been brought into effect and are actually in place and being investigated, or I guess if these new revised regulations, if they're actually being enforced by WorkSafe BC in the province of BC today?
Minister.
Thank you, Honourable Chair. The member made a comment about the nurses being overstretched, of course. That's why I began my opening yesterday thanking nurses, all healthcare workers, because they were asked to do a lot more than what they normally do, especially during COVID and even since. The population growth, put a lot of pressure on our healthcare system and many other services that we provide, education, transportation, everywhere. And we certainly recognize the challenges that the nurses and other healthcare workers are facing, having to work overtime. A member said double shift. I take all that because I want to acknowledge that the nurses are doing a lot more than what they signed up for, and that's what they do. That's what they are. And I just want to say thank you. I appreciate the extra effort that they make. Certainly, it affects their health, of course, but recognizing all of that, the government together has hired close to 6,500 net new nurses last year. So is that enough? I think we are continually recruiting healthcare workers, the teachers, the doctors, because population growth demand more resources. And I think there are many challenges our nurses and healthcare workers face, and I thank them deeply. The question that a member asked about this new regulation, it is in effect. It is to deal with, there are some drugs that are used to treat patients. They could be harmful to the workers who are administering them. And, I mentioned some of them to treat cancer. And so as a result of that, that regulation came, and to make sure that employer are in compliance, to make sure that the workers are protected. But But if there are some issues, WorkSafe BC work with the employer to make sure that the workers' health and safety is protected while they are helping the patients to administer those drugs.
Member.
Thank you, Honourable Chair. Is it the Minister's interpretation that cocaine, heroin, fentanyl, illegal substances are not covered by this new regulation?
Minister.
They're not covered under this agreement because they're not legal. The agreement, the regulation only is to deal with the drugs that are needed to treat a patient, and now the worker need to handle, and they could be harmful to the patient. So that's what the WCB is working with all employers to make sure that that there is a system in place to protect those workers.
Member.
Thank you, Honourable Chair. Can the Minister clarify? There seems to be a pretty substantive piece of regulation that deals with providing workers protection from what the Minister has described as legal drugs. Is there such an agreement, a regulation that exists to protect workers from illegal substances like toxic cocaine, fentanyl, or heroin?
Minister.
Thank you, Honourable Chair. That regulation that member talk about, again, it is to deal with drugs that could be harmful to workers, but they are used to treat patients. So that's what this agreement and this regulation is there to deal with. And that's what the WCB will work with the employer to make sure that the workers' health and safety is protected.
Member.
Thank you very much, Honourable Chair. Look, I appreciate the response from the Minister, and I am aware I have had an opportunity to have a quick look through the regulation, and I do appreciate there's substantive requirements of the employer to provide necessary protections when workers are working with or come into contact with drugs and chemicals that could provide or could result in significant harm. We've also identified and been talking lots for the last few days about toxic drug chemicals that workers are exposed to that are not lawful, and yet I haven't seen the same level of rigor or regulation or requirement on the employer to provide that same level of effort to provide those necessary protections to healthcare staff working in facilities that are exposed to illegal substances. So through Honourable Chair to the Minister, can the Minister share why there would be one set of rules to deal with legalized drugs and the potential harms that those might pose to a workforce versus illegal substances that workers are, as has been evidenced and documented, or have been exposed to in the workplace setting, where the employer has been unable to provide those necessary protections to ensure that workers in the healthcare services sector are not exposed to toxic illegal substances, why there is a differing in approach with respect to those two different subsets of drugs that have a significant potential of being of harm to healthcare workers in BC.
Minister.
Thank you, Honourable Chair. Look, there are all kind of different approaches through occupational health and safety to protect workers from exposure to any harmful substance. And if the member could go back into the compliance agreement, one of the part of the agreement does talk about the organization's unregulated substance education training will be reviewed and where necessary modified so that it effectively addresses the harmful drugs exposure. Then it goes on to say that the facility safe uses plan for acute care settings will be drafted that defines both short and long-term strategies to protect staff from exposure to unregulated substances. This is to deal with if someone who is addicted comes for treatment, use the example of a broken leg, start to use to feed their habit, that there are some requirements by the employer to deal with the exposure to potential exposure to the workers so that the workers are protected. So they are handled differently than that regulation.
Member.
Thank you, Honourable Chair. In the Minister's response, I get the notion that healthcare professionals that are healthcare facilities are required to accommodate the use, not just the perceived, but the actual utilization of toxic and harmful drugs in our healthcare facilities. Can the Minister confirm that is his understanding and that it is acceptable and accommodated by healthcare staff to allow for the utilization of toxic and harmful drugs in our healthcare facilities in our province?
Minister.
I think that, thank you, Honourable Chair. That question is more appropriate to the Minister of Health, and he has answered it more than once.
Member.
Thank you, Honourable Chair. I believe it is not, certainly my purview, it's not necessarily, although the health minister should certainly be concerned, we're talking about the protection of workers. Employers have ultimately the obligation to eliminate risk of safety or dangerous chemicals to workers. And where the elimination is not possible, and I would argue that elimination of the risk, I think, certainly is possible, but there's been little, if any, effort undertaken to eliminate that risk if indeed patients or visitors to hospitals are coming in and have the ability to freely walk in with toxic drug chemicals, and if they're being utilized in the facility and the use of those drugs is being accommodated and acceptable, if it is indeed the view of this minister that it is acceptable, well, the policy of this government is actually leading and contributing to the exposure of harmful drugs to workers in the province of BC. Through Honourable Chair, to the Minister, can the Minister confirm that it's his understanding, or maybe it's even his position, that it is the requirement of healthcare professionals to accommodate the use of toxic drugs in healthcare facilities in the province of BC?
Minister.
Thank you, Honourable Chair. My ministry do not deal with healthcare professionals. They come under Ministry of Health. They have their own regulating bodies, what they're allowed, what they're not allowed to do. We don't, Ministry of Labour don't make the policy that the member is talking about. And I think he's fishing for something that he's not getting, and he's keeping asking the same question over and over. But I think we here as a Ministry of Labour and through the WCB are trying our best to make sure the workers' health and safety is protected. And we have gone over and over and over in the event that someone comes into the health facility with addiction and they try to use the drug that they're addicted to, there are protocols that I have laid out. There are regulations that applies, that require employer to take certain actions, and I just read what they are. And member has a copy of the compliance agreement with him. It's all written in there. And so I think, he wants to, debate a certain policy that my ministry is not responsible for. I think he's trying, but that's not up to this minister or for this forum.
Member.
Thank you, Honourable Chair. I appreciate the response from the minister, but the reality is that workers are continuing to being exposed to toxic drugs. We're hearing reports of nursing staff. One nurse in particular that was pregnant, had recently given birth and was told after being exposed to drugs to stop breastfeeding her child. These are very serious allegations, and when our healthcare workers cannot go to work knowing that those necessary safeguards are going to be put in place and they're put in a very dangerous situation, it's incredibly concerning. And I certainly would hope that the minister, if true to his word about wanting to ensure that workplaces across BC are the safest in Canada, there are initiatives and efforts that could be undertaken by government in order to reduce the incidence of exposure to toxic drugs by healthcare workers in the province. And yet, we are not seeing that action. Honourable Chair, I'm just going to ask this of the minister. With respect to the compliance order that was closed out on February 27th, in light of the additional reporting that we've seen in media across BC with respect to ongoing worker exposures, what will be the minister's next steps with respect to conversations with WorkSafe BC, or maybe even advice with WorkSafe BC, on what are those next steps to be undertaken to help to elevate this concern with the employer, and to ensure that the employer does become compliant and ensures that workers that are working on healthcare facilities around the province are provided those necessary protections to eliminate the exposure to toxic drug chemicals.
Minister.
Thank you, Honourable Chair. Works at BC, during any issues that are raised by any sector, they have processes of getting engaged with the employer and who else, other stakeholders, to make sure that they look at the issue and to find what the solutions might be. Same thing here in healthcare. They work with the healthcare health authorities, also with the Center for Disease Control. They are engaged in a working group that they have, and trying to figure out what other new policy that could be implemented to deal with the issues that are brought on. There has to be a risk reduction program. That's what they always. That's one of the kind of approach. They also have a dedicated healthcare inspection teams. And 2024, they are again planning for targeted inspections of the facilities. So that kind of work is ongoing. Anytime the issues are continue to come from certain sector, in this case, the member is interested in healthcare, then yes, in this particular case, that is the approach that the WCB get engaged in, working with the health authorities, with the Center for Disease Control, and the health and safety committees, and the group that they have a working group that they're involved with. So learn from what's going on at workplaces and come up with the policies that might help resolve the issue.
Member.
Thank you, Honourable Chair. We're seeing an increasing trend both with the exposure of workers, healthcare workers, to toxic drug chemicals, also seeing an increase in the incidence and the costs associated with mental disorder claims, as the minister had shared. Where we see an employer with responsibility for worker safety, and if we look to the mental disorder claims, the increasing number of mental disorder claims, just as an example, where an employer appears to have ongoing claims costs and worker injury associated with within their sector or within their employment. Through Honourable Chair, can the Minister share what steps WorkSafe BC would be undertaking to work with the employer in that instance to identify, the root cause, to identify opportunities for improvement, to identify opportunities that the employer or efforts or initiatives the government could undertake in order to see that trend line go in the opposite direction, to actually start improving worker safety. We've seen over the last 6 years now a continual escalation of the number of mental disorder claims, significantly negatively impacting the health of healthcare workers in the province of BC at considerable cost to taxpayers. And I can't imagine that the minister would have the position that in any way is acceptable. We always want to see our workplaces becoming more safe, to see worker incidents of accidents and claims going down. And so, through Honourable Chair, to the Minister, can the Minister share what efforts he or his ministry has undertaken with respect to working both with WorkSafe BC and the employer to drive change that's absolutely necessary in order to reduce the incidence of claim costs to nurses in the province?
Minister.
Thank you, Honorable Chair. So there are a number of ways WCB engaged with the industry, the workers, through their number of departments. One of them is it's under the prevention services, is prevention risk management services. So what they do, as I'm advised, is that there's always a scan if there's an escalation of claims from certain area, that they get engaged to meet with the individual employer, the industry. In the healthcare, for example, they will meet with the health authority, and I'm advised all the way to the CEO of that health authority, the union who represent those workers, their health and safety committees. Idea would be what is driving those injuries from that particular area, and possible solutions, how we can prevent them. So that process is not only just for the mental health, for any injuries that are that comes through scan to their attention, that there may be attention is needed here to make sure that we find out the root cause of the increase in injuries and claims, and then all of those things that I mentioned get into gear and try to help the employer and the workers to find the root cause and find some solutions.
Member.
Thank you, Honorable Chair. Look, as we've seen, this is not just something that's new or unique this year. Over the last 6 years, we've seen a significant increase in mental disorder claims, largely in the healthcare services sector. I know the Minister did reference one particular legislative change with respect to presumptive cause, which likely may and most likely has contributed to an increase or escalation. But even with that, we are still seeing this ongoing escalation. I would surmise, or I would assume, that at some point WorkSafe BC would see this as a considerable a concern to bring forward and to engage more directly with the employer to, as the Minister has indicated, to undertake that root cause analysis, to identify what is contributing to it, and then to put pressure and encouragement on the employer in order to address it. But those initiatives and actions obviously are not resulting in any decrease. And I do appreciate that penalties should be a last resort, but where we see this increasing trend line over the last 5 years continue to escalate, significant cost to taxpayers, significantly disruption, and likely cause of concern to many of the healthcare workers that have experienced and been resulting in a lost time accident respective of mental disorder claims, that at some point in time, WorkSafe BC would levy an administrative penalty. So, Your Honourable Chair, to the Minister, has WorkSafe BC given consideration to administrative penalty? And if so, are penalties based on the potential payroll size of the entity? It's my understanding that quite often when levies or fines are leveled against an employer, in this case might be a health authority, that penalty is a percentage of their overall gross payroll. And so, Your Honourable Chair, to the Minister, could the Minister share, one, has WorkSafe BC considered escalating this to the level of penalty in order to get the employer's attention, to ensure that they're addressing and actually seeing a reduction in the number of claims? And then two, if a penalty was to be considered, if the Minister could share what the magnitude of that cost would be with respect to an administrative penalty established against a health authority.
Minister.
Thank you, Honorable Chair. I think it should be said here, the reasons for mental health or psychological injuries to be that they're escalating, they're increasing, and the cost therefore is increasing. But we need to go back. Mental health injuries were not. It took a long time for mental health injuries to be considered to be work-related injuries. It took a long time for society to accept, for employer, WCB to accept, and then they were accepted. The claims were accepted, but it was a very difficult process that the worker has to go through to prove that it is work-related when they file a claim. So it took a long time. And some, activists argue that you're re-traumatizing the worker again by, repeating what they saw, what happened to them that caused the mental health injury. So that's therefore a presumption argument, and why we brought presumption. For the frontline workers, then we added nurses and the care aides. So when you look at, when I gave you the numbers, the number of claims filed were much higher than claims accepted in the first 2 years when the presumption was not in place. And once the presumption was brought in, now it made it easier for a person suffering from mental health to start to get support that they need, rather than re-aggravating and re-traumatizing, trying to prove that it is work-related. So the claims are accepted more easily now, and the support is available much faster, rather than let it, go through it, and then that actually make the situation even worse by the time you actually get the treatment. So I think we need to put that in context, the claims and why the claims numbers in 2016 and where they are today and the cost therefore. Now, member asked another question about calculating penalties, whether we should, the WCB should be looking at penalties as probably incentive for employer to comply and do a better job. They have mental health strategy that has been developed, and it is now they're developing regulations, and it would be as helps put it to me is that the cornerstone of that is to look at what strategies can be to make employer to accept, understand how to mitigate conditions and situations that may cause the mental health. And those regulations, once developed, they will be going out for consultation. So they are taking initiatives already to deal with the issue of mental health. And yes, the cost is high, the claims are coming up. But does that tell you? That tells you a story that there are issues at workplaces, and we need to work with the employer and the workers, their representatives, to make sure that we deal with those. And that mental health strategy, I'm really looking forward to hopefully that would address those issues. Now, how the penalties are calculated, going with the payroll is one, but it's 2 pages of policy how they calculate penalties. If a member wished to, I could read it all, but there are a number of areas here, repeat offenders, and that could be, and then what the maximum is. Maybe I should read parts of it. An administrative penalty cannot be imposed if the employer proves it exercised due diligence. Assuming due diligence is not proven by the employer, works at BC must consider a penalty when there is or are a high-risk violation, repeat violations, or failure to comply within a reasonable time, an intention to commit the violation of claim suppression, obstruction or violation of stop work or stop use order, circumstances warranting penalty consideration. The basic penalty amount prior to multiplier are being applied is 0.5% of employer's payroll with a minimum of $1,250 and a maximum of half the statutory maximum. Once the basic penalty amount has been calculated, multiplier may be applied depending on the presence of certain factors, including high-risk violators, intentional violations, obstructing an inspection, dissuading the reporting of a claim or safety information, or violating a stop work or stop use order. Multiplier may increase the amount of penalty to a maximum stipulated by the statutory maximum. So there are a number of others, but I mean, it's not a very straight, simple that, yes, the payroll calculation is one of them, but then there are a number of multipliers based on all of the things that I mentioned.
Member.
Thank you very much, Honorable Chair. Where there is the incidence of continuing and repeat worker accident claims, whether that be for mental disorder claims or otherwise, where an employer is exhibiting the inability to curb or reduce the incidence of workplace injuries, would the minister agree that it would be appropriate for WorkSafe BC to move to an administrative penalty, even if that happens to be another level of government?
Minister.
Thank you, Honorable Chair. So penalties are not determined based on who the employer is, whether they are private sector or they are another arm of the government, or we could call it the, just say education, health, and you name it. The penalties are levied. There are some health authorities that they received big, heavy penalties as well. And so is sometimes school boards. So they don't, and then there are private sector. They also get the max. So I think the larger the employer, they start with pretty large penalties, and which include both government, extension of the government or private sector.
Member.
Thank you very much, Honorable Chair. I am familiar with one specific fine or levy that was imposed against, I believe it was School District 83, and it was related to some work in and around asbestos, and it was a sizable, like a little over $100,000, I believe, was the size or magnitude of that, and that's on a relatively small payroll for a school board. I could only imagine what the magnitude of that fine or levy might be for a health authority. But I think what I'm hearing is the minister indicated that WorkSafe BC's mandate is no different for an employer that might be a health authority, a school district, or a private sector company. And so, I certainly would not, and I would never expect, and I don't think British Columbians expect, that WorkSafe BC just immediately go to a penalty. But where an employer is unable to reduce the trend line or the incidence of occurrence of workplace injuries, at some point in time, the WorkSafe BC will have no other alternative but to step in and impose an administrative fee. And I think what I'm hearing from the minister is that that would be acceptable, and there'd be no quarrel with the ministry with respect to that independence of WorkSafe BC to levy those specific fines in order to ensure that employers actually modify or change either their policies or their behaviors in order to ensure that workers are protected. I am coming to near the end of my time, Honourable Chair. I do have just one last question for the minister, and that has to do with the Worker Accident Fund. If the minister could just report out on what the size of the Worker Accident Fund is today, or as of December 31st, 2023, and with that, if the minister has any concerns about the continuing deterioration of the Worker Accident Fund, the surplus, which is above and over and above the 130%, which is statutorily required.
Minister.
Thank you, Honorable Chair. The, at the year-end 2023, WorkSafe BC continued to be in a financially strong position. WorkSafe BC funded position remained above 130%. That's the target level due to investment return in most years outperforming the interest requirement on our liabilities. But coming down to the numbers, the funding level was 155% in 2021, 146 in 2022, and 142 at the end of 2023. And the decline in the funding level is the result of increasing claim cost, using surplus fund to keep the premium rate below cost, and the increased claim liability resulting from a number of government initiatives. So I think we are still in a pretty good position. It's market-driven largely, as we talked about. There were years that the return was better than anticipated, and there were, because of market condition, it was less than. So am I worried? No, I'm not worried. I think we're still in a very, very strong position, and that's why we're able to keep the premium for the employers on average basis much lower than the actual cost of claims are. My understanding is this year we are still at $155 per 100 payroll, but the actual cost is close to $80 per 100 payroll. So I think we are in a pretty good position, and both employers enjoy the benefits of the surplus, and we're able to make changes so that the workers also can get their benefits improved.
Member.
Thank you very much, Honourable Chair. I just wanted to lend my appreciation to the Minister and for his staff for the relatively concise answers and for the information that's been provided. So just through Honourable Chair to the Minister and staff, thank you very much.
Minister.
Thank you, Honourable Chair. I also like to take this opportunity. I think most of my time as a Minister of Labour, the member was the critic. And there was another member from that party before that for a short period of time. And my understanding is that this would be his last set of estimates, and I want to wish him well in his next endeavor. Enjoy working with him. And I think he took his job very seriously. And so I just want to say, best of everything in your next endeavor, and wish you well, you and your family, and hope that you can spend more time with your family, and family certainly would be happy. So I just say thank you very much for showing professionalism in our deliberations here.
Thanks, sir.
Thank you.
Recognizing the member from Parksville, Qualicum.
Thank you, Chair, and it's great to see some friendly faces here that I can remember from some time back. My first question is about precarious workers, gig workers in the province of British Columbia. We know there are about 11,000 according to provincial numbers, ride-hail drivers, 27,000 food delivery service drivers. As we look at this fiscal year, and obviously reflecting on the changes that came through legislatively last session, it's going to make a huge difference for a lot of workers in this province, people who are new Canadians, people who are visible minorities. Question through the chair to the minister is, what can ride-hail drivers, food delivery service drivers, what can they expect this fiscal year when it comes to their working conditions?
Minister.
Thank you, Honourable Chair. And let me take this opportunity to thank the member, because who was the parliamentary secretary responsible to deal with the gig workers and precarious work. And he went around because government wanted to consult with the workers, with the ride-hail companies and academics and the workers' representatives, went around and met directly. And I remember sitting at least in one such meetings with the member in Guildford, and listen to the stories of the workers. And yes, these are, relatively speaking, new immigrants. racialized workers. And the way the companies have treated them since they started to operate in British Columbia as contractors, and which means that the Employment Standard Act do not apply to them, according to them. And I have said all along that the workers have every right under the employment standard, regardless where they are working, unless they have special exemption in the Employment Standard Act or the regulations. Anyway, we also felt, with the help of this member, that we understand this is a different type of work. And it is not your traditional 7 to 3:30 work with a couple of breaks. Then you are there until you get permission from employer during those hours to leave your place. Compared to the gig workers, they have this flexibility to turn their app on or turn their app off whenever they wish to do that, which day they want to work, which day they wish not to work. So that's the kind of the dialogue we received from the worker. They want to maintain that flexibility. So they couldn't really bring them into employer-employee relationship if that was the case. And so we recognize that. Other issues that they brought up was the transparency, as the member would know. They need to know what their earnings are, what their deductions are, and where their trip will take them before they accept it, what the pay would be, and also the WCB coverage. So they were worried that they are not covered if there is a workplace injury or illness, and also what their minimum wage should be. So I think all of those were put together thanks to this member. Then we continue on with the member from Burnaby North in that position. Now then we passed the legislation. The member was present, and those are the area that we are dealing with through legislation that authorizes us to develop regulations, which we are doing now. Again, consulting with the workers, with the ride-hail companies and the food delivery companies and academics, the unions. BC Federation of Labour, I want to thank them because they've been very, very helpful promoting and advocating on behalf of the workers. And so those regulations are being developed. And once we finalize, one part was also the car expenses that they bring to work. And so that also would be part of the regulations that we're doing. So those areas of regulation we're developing. Tip protection is another one. And also there's another one. The fair process, if there was a deactivation of their app, and what process is available to them to get it reactivated. And so those are the areas that we are looking at dealing with those and the workers' compensation coverage as well. And we are getting closer, and then they will, I think we'll hopefully get cabinet approval, and then they will be implemented. My intention is to have it complete as soon as possible, but those are the areas that they can expect that we are dealing with, and we are actively listening still, but I think they need to have protection on those areas so that they can also enjoy life when they are working. And many of them are, as members know, are depending on this job. They are full-time workers, and they sometimes feel that their app is being deactivated for some of the minimum frivolous complaints by a passenger. One example, just the other day, somebody phoned to tell me that they had a passenger, and passenger wanted to smoke in the car, and he told them, no, they cannot smoke inside the car. And so next day there was a complaint, and his app is deactivated. So it took a while for him to get back to the company, and the company said, yeah, you're right, and they're wrong. But in the meantime, they lost work, and because the work is only available through app. So those are the areas that we are dealing with. We looked at other jurisdictions also and listened to these workers, and hopefully that we would be in a position soon to make some announcements.
Member.
Thank you, Chair. And I remember the passion that the minister had to ensure that these workers had the rights they deserve, and I appreciate that that passion is still live and strong. I still hear from workers in this industry about I don't want to say a lack of progress. We've seen incredible progress with this. It's a tough file. We want to make sure that that these workers have the flexibility that they've asked for. Obviously, there is no crystal ball. I can't ask the minister how quickly this will get through cabinet, but I'm wondering if just a broad sense of the timelines, could workers expect that these protections would be in place by this summer?
Minister.
Thank you, Madam Chair. Member will also know, yes, there's a frustration. The workers, if you're working, you like to have those protection available to you yesterday. But I think if you put that in context, Ubers of the world, the ride-hail companies came to BC at a very, very late stage compared to all other major cities. Like in Seattle, they've been there for over 15 years. Toronto, 15 years. New York, 15 years. And all other major cities, they were there. They came to BC only in 2020 because we want to make sure that there's a level playing field for people who are locally providing their service right now. And but even those jurisdictions, New York, it took them a long time to come up with regulations or change the labor laws to protect workers and their wages and the working condition. Washington, just a couple of years ago, they came back. They came to develop the regulations for these workers. But we are within about 3-4 years. We are moving very fast if you compare to all of that. Because, like the member said, this is not a very simple area to move in and come up with some easy answers. There's been a lot of fight, pushback. In Toronto, they went all the way to Supreme Court of Canada because agreement between the ride-hail company and a driver, if there was a dispute, required them to file a complaint in Netherlands. So the trade union movement took that case and fought that. But the companies took them all the way to Supreme Court of Canada. And Supreme Court of Canada had to decide, no, you cannot contract out your labor laws or our laws from Canada. So they had to change that. So there's a fight all over, pushback by the companies. But I think we are working very closely with the companies and the workers to make sure that we have these protections. At the same time, the companies, feel that they can continue to provide the service, and people who are getting used to this will continue to have this service. So our hope is that we will have these regulations completed by this spring, and then the companies will need some time to make changes to their system of payroll to implement those. So that's the kind of a debate that is having right now, or discussion that is having right now.
Member.
Thank you, Chair. I appreciate the timeline. And just for clarity, so hopefully this spring the regulation's in place. How long is it anticipated that it will take for the ride-hail companies, these platforms, to be able to adjust to the regulations? How much time will they be given before the workers get the protections that they are hoping to receive?
Minister.
Thank you, Honourable Chair. Thank you. Welcome. And there is the companies are making an argument that they need a lot longer than I think they need. But that's the kind of discussion we're having. And I want to make sure that they have enough time, but not the time that they're looking at years or plus. But we're saying that there should be a reasonable time for them to adjust their. I mean, these are tech companies. You know, they have this, the know-how and technology to make quick changes, and it's a payroll change they have to make, and how to calculate the wages, the deductions, and how to compensate them, for example, the car expenses, and put together a fair system to deal with the activation, deactivation. And because, of course, workers are waiting. Workers are waiting. They want to have it implemented quickly. And I agree with them. But again, the reality is that the companies do need some time to make changes. So I think we're hoping to bring it in as soon as we can. But yeah, those are the discussions we're having.
Member?
Thank you, Chair. No, I appreciate that. It must be frustrating for a lot of these workers. They many of them come to this country. This is their first job. They work hard. The folks that we heard from, some of them working 16 hours a day, and being promised that this is coming. And I appreciate that the minister is committed to moving this forward in a timely way. Next, I'd like to chat about the Employment Standards Branch backlog. Just wondering where are we currently at? I see the service plan is targeting that next year we should be at 80% for 180-day turnarounds. Just wondering if the current budget that is in place right now is sufficient to be able to meet that objective.
Minister?
Thank you, Honorable Chair. We have 4,600 complaints in the lineup right now. And I think to put things in, again, context, member will know that I would say that the backlog always existed. Why I say that, when you go back to, say, 2014 and 15, that number of complaints came to Employment Standard Branch was like 4,600. In 2001, the complaints were over 11,000 a year. So number of changes took place. Half of the Employment Standard offices were shut down. Half of the staff was laid off. And then on top of that, self-help kit was introduced. So that was to frustrate the workers who had a complaint. Who wants to go back to the employer who cheated you out of the wages in the first place? That's what the self-help kit required. So they just gave up. So complaints started to drop. Soon we got rid of the self-help kit. We started to increase the staff at the Employment Standard Branch. We added a lot more work to the Employment Standard Branch because there were so many changes that were made by the previous government, removing rights of the workers. For example, they moved from 12-month retro in case somebody was filed a complaint for lost wages. You could have gone 24 months in the 1990s. When they came in, they moved it to 6 months only. So we, as per the recommendation by BC Law Institute, we moved that to 12 months. We also brought in Temporary Foreign Worker Protection Act. That required employer to register. And during COVID, the temporary layoff lasts only 13 weeks. But many employers and workers knew that their employment would be shut down longer than 13 weeks, which means after 13 weeks they have to be paid severance pay, and employees are severed. But they wanted to keep that connection. So we have a provision in the Employment Standard Act that they could actually apply for variance. So we, I think somebody would help me, how many applications came for variance. That add to the work as well, along with all the other challenges that were with the COVID. So that started to cause the application back up a bit. Also, as a result of all the changes that we made it more easier for a worker to file a complaint and get it investigated. Now the complaints are coming back again. The last I checked is like 7,600 complaints. 8,000 complaints are coming per year now. So I think, so I would say that the backlog was always there, but it was hidden. People simply didn't file complaints. Now they are filing complaints, but because of COVID-related and other reasons, the workload increased. But as a result, we knew that would happen. When we formed government, $14 million over 3 years were added to the Employment Standard Branch. Then budget 2023, another $12 million was added to over 3 years to add resources to the Employment Standard. But it'll take some time for us to catch up to all the applications, because the end goal is to make sure all complaints are investigated and justice served in a timely fashion. But it's taking a little longer than I thought.
Member.
Thank you, Chair, and I appreciate that. It was great to see the lifts twice, but it's sort of static at inflationary levels. And the question was whether this current funding would be sufficient to bring that backlog down. And I just hope, if anyone from the Finance Office or Premier's Office is watching this is important stuff. And if the Ministry needs more resources, I certainly hope that those resources come forward. I've talked to many employees who are in this limbo waiting. they file the complaint and then time goes on and they're stuck with their employer. Their employer knows, the employee knows. It's a really awkward situation, and it puts workers in a vulnerable position. So I'm, as my last question, recognizing that time is limited in this place, it is Daffodil Month, and no perfect thing to end on than cancer. Obviously, this package, I can't use props, but I know the Minister is well aware of the questions that are within the lobby briefing from the BC Professional Firefighters Association. There's been some incredible work done by this ministry to support first responders, especially with changes to the Workers' Compensation Act. Looking through, I'll narrow down the lobby requests from, I believe there's 3 core requests that below them have many. But just to focus in on here, there are 3 different types of presumptive coverage that is in the first request: mesothelioma, skin cancer, and laryngeal cancer. The risks are significantly elevated for firefighters. But also in the second request is a required mandatory screening once a year to detect these cancers. Just looking through the chair to the minister, if the minister can provide an update on what firefighters can expect for these 3 requests as far as coverage, as well as their request for annual screening. And I will leave it at that. And so it doesn't have to come back to me. I just want to thank the minister and his staff for taking this time here and the incredible work they're doing. Thank you.
Thank you, member. Minister.
Thank you, Honorable Chair. Thank you for raising this very important issue. As the member knows, the firefighters are very good in bringing issues that are important to their members' health and safety. And as a result, we are now, when it comes to the presumption of cancers, we are at number 18, and yes, they're asking to expand that, and also the latency on some of the areas. Those 3 areas that the member raised, yes, they raised it with me. They came and met with me, and we are reviewing what they brought to us. And just like all the other areas that we made improvements since we formed government, I'm sure we'll have more dialogue with them, and then I think then we will, appropriate time, we will deal with this or make a decision.
All right. Seeing no further questions, I ask the minister if they would like to make any closing remarks.
Thank you, Honorable Chair. I just want to thank my critic, the member from Parksville, for asking some very good, intelligent questions. And it is always my privilege to an honor to make sure that the workers' lives in this province, their wages and wages and benefits are continue to improve. Their health and safety continue to improve because I think they are the key part of our economy that continue to move the economy under sometimes very difficult times. So I want to thank all the workers. I want to thank all of their representatives, their health and safety committees, because, Madam Speaker, I don't even I think, attempt to guess how many lives are being saved by the work of those health and safety committees. How many injuries have been prevented due to the workers, workplace health and safety committees. I, being one of them during my time before my election, that work sometimes is considered nuisance by their fellow workers, by their colleagues, when you are asking them to not to take shortcut. But there are production pressure, there are other pressures. They want to make sure that work continues, and sometimes they take risks. And this is where the safety committee members come in. They educate them, they work with them, they talk to them, and many times they push them aside, sometimes physically, say, hey, this is not where you want to go. And so I just want to say thank you to all of them, their representatives, the workers who go to work every morning, pack their lunch pail, go to work hard, number of hours during the day, come home, take their kids to the games, then come home, cook and eat and start the day all over again. I think those are the people who pay their share of taxes, they obey the law, and I salute them because I think without them, our economy, will not move. Yes, it's employer and workers working together. At the same time, making sure that they're working together. That is the role that our ministry play when it comes to health and safety and also labor laws. So I want to say thank you to all of them, and thank you for the opportunity for me to speak on behalf of the ministry.
Great, thank you, Minister and all members. Seeing no further questions, I will now call the vote. Shall vote 38 pass? All those in favor say aye. Aye. Any opposed? Okay, the motion is carried. Thank you, members. We are now going to take a 10-minute recess to give an opportunity for the next ministry to settle in. Thank you. I call Committee of Supply, Section C, back to order. We're meeting today to consider the budget estimates of the Ministry of Social Development and Poverty Reduction. I now recognize the Minister to move the vote.
Thank you, Chair. I move that a sum not exceeding $5,175,972,000 be granted to His Majesty to defray the expenses of Ministry of Social Development and Poverty Reduction, Ministry operations to 31st of March, 2025.
All right, thank you, Minister. Do you have any opening remarks?
I do. Thank you, Honourable Chair. Welcome to my opposition critic and to other members observing. Recognize we are here on the territory of the Algonquin-speaking people, Songhees and Esquimalt First Nations. Supporting me today, my Deputy Minister, Alison Bond, Assistant Deputy Ministers, Adam McKinnon, Raymond Filch, yes, Karen Blackman off screen, Suzanne Christensen behind me, Dwayne Quinnell also off screen, Sam Turcott. Tomorrow, Executive Director Robert Bruce is here. Tomorrow we'll have CLBC CEO Ross Chilton. Thank you to all the staff at Social Development and Poverty Reduction, especially those working on the front line who support people every day. This ministry is part of the day-to-day lives of so many people in British Columbia, from assistance offices to Work BC centres, to our community integration specialists who provide in-person, in-community outreach service to people, and to all the CLBC staff, to all the home share providers, and more. Together, we're working to support people in living a full and dignified life. Since 2017, we've helped over 250,000 people out of poverty through things like job training, childcare, increasing income assistance rates 5 times, increasing minimum wage 7 times. But global inflation and the terribly increased cost of living have been especially hard on people who were in many cases already struggling. And that's why earlier this year, just last month, we amended the legislation to set new poverty reduction targets so we can better help people get out of tough times. Our 2019 goal was to reduce poverty by 25%, and we reduced it by 45%. This is based on 2021 numbers, the most recent year for which we have StatsCan data. And we reduced child poverty by more than 50%. So we are on the right track, but we are nowhere near satisfied. We see all around us all the signs of increasing pressure on people, and that the 2021 numbers are not necessarily where we are today. And so that's why we have legislated new ambitious 10-year poverty reduction targets to reduce the poverty rate by 60%, the child poverty rate by 75%, and for the first time we've set a new target to cut seniors' poverty. That is a 50% reduction target. These 10-year targets will keep us focused on systemic and generational change. In another area of work, because people say that they feel better and they're better off when they have a job and the community connections that come with having meaningful work, we are reducing barriers for those who can work while continuing to support those who cannot. So we amended last month our income assistance legislation. We got rid of mean-spirited financial penalties that too often pushed people deeper into poverty. We advanced our commitment to reconciliation, and we made significant change to the employment requirements for people on income assistance to better support them in finding and keeping a job. I'll note that those requirements are not incumbent on people who are on disability assistance, but if they want to avail themselves of those employment supports, then they certainly can. In the area of food security, improving food security, especially in times of global inflation, is a real priority. Historic new investments in food security are helping people better access low-cost, fresh food. Last year, my ministry invested over $50 million to strengthen food banks, food distribution, and food access. That includes direct funding to local food banks, rapid access to food during events like wildfires, helping solve challenges faced in particular by northern communities, supporting school food programs, those who need a little bit more help and setting up new systems than what the Ministry of Education funding made available for them. We funded a First Nations Wellbeing Fund Food security infrastructure, like organizations that wanted to build warehouses or refrigerator trucks, greenhouses, that all fits into the food security infrastructure. We funded more local food hubs. We funded in my own riding, Loaves and Fishes, a new warehouse that they're going to build also, again, for food rescue and distribution. We are working with community organizations to ensure that there's help for people who are struggling to put nutritious food on the table. The member for Langley East, who also happens to be the chair, in her role as Parliamentary Secretary for Community Development and Nonprofits, has done very good work advancing and advocating for the province's not-for-profit sector. They are vital to people and communities in BC. They help us deliver housing, health, cultural supports, and food security. They're really important partners, often delivering services to the most vulnerable people in all corners of the province. And that's why last year and the year before, collectively, we funded over $90 million to support not-for-profit organizations that are providing key services for people in communities. The Parliamentary Secretary for Accessibility, the member for North Vancouver Seymour, is also working hard. She's focused on removing barriers and creating more to accessibility and creating more inclusive communities. Implementation of the Accessible BC Act, which was passed into law in June 2021, provides a legal framework for government to identify, remove, and prevent barriers faced by people with disabilities. By September 2023, more than 750 public sector organizations had established accessibility committees, accessibility plans, and public feedback mechanisms. Right now, 2 technical committees are developing employment accessibility standards and service delivery standards. Very grateful to the advisory groups that are helping us build that work. They're people with lived experience. We're very grateful for their expertise, their lived experience and knowledge. Later this spring, public consultation on the new accessibility standards will begin. In the area of employment, we all want people to have meaningful work to build better lives. But people in BC facing multiple barriers to employment, for example, Indigenous communities, people with disabilities, newcomers and immigrants, they all need more training opportunities in many cases. That's why, with funding from the federal government, we are investing over $470 million every year as part of the Canada-BC Labour Market Development Agreement, the LMDA. Thanks to this funding, over 110,000 people in BC get connected to skills training and good jobs every year. Community Living BC also plays a unique and important role in our province. Our government wants people with developmental disabilities to get the supports that they need to live good lives. And more than 27,000 adults with developmental disabilities and their families are served every year by CLBC. Its own crown, but within the umbrella of my ministry. And the number of those people that are needing services are growing. And so in this year's budget, we have added $135 million for the 2024-25 year to address both my ministry and CLBC caseload pressures. That's $405 million over 3 years. We've also added in this year's budget over $159 million in 24-25. That's budgeted to address salary increases for BCGEU employees and management and for CLBC service providers and staff. That's $477 million over 3 years. Global inflation is being felt by everyone. It's been particularly difficult for people offering addiction treatment and recovery centers who support people challenged with mental health and addiction illness. So we are also funding in this year's budget over $20 million for mental health and substance use per diem increases. That's $60.5 million over 3 years. In conclusion, let me say my Ministry of Social Development and Poverty Reduction has been working hard to deliver essential services and to develop critical policy. We want people to have the services that they need. And in tough times, in all times, we know that we are strongest when we look after each other. That's why we're investing in people. And while we are proud of what we've achieved as a government and as a ministry, we acknowledge that there is much to do. People are hurting right now, and we as a government are committed to doing that work. Thank you again to the chair and to my colleague across the way. I'm looking forward to your questions and the conversation. Thank you.
Recognizing the member for Peace River North.
Thank you, Madam Chair, and thank you to the Minister for her opening remarks. And also like to welcome all the staff that is here today joining us to, yes, and the other ministers and MLAs that are feeling lonely. Thank you for being out here as well. Also want to thank, of course, all the staff that, the ones that, not to put down anything, but the ones that are doing all the frontline work and, making a real difference in people's lives out there on the road that are going through some significant challenges. The minister had mentioned a number of times about the affordability crisis, and it is just that. It is a crisis. And there's probably no other group of people than, of course, our vulnerable that are feeling those challenges right now across the province, just to try and get through the day, whether that's trying to find somewhere that's safe to sleep, or some food to have, or seeking medical attention, and the list goes on and on and on. Over this past year, I know the minister has as well, meeting with numerous folks in different groups around the PWD, advocacy groups, people within food banks. I've had the opportunity to travel across the province, visiting different food banks. And, when you're talking to folks that are, really trying to deliver these much needed services, that's when you really get an understanding of the challenges that we're in right now across the province. And, folks on persons with disability, they're really struggling to make ends meet. And, it's sometimes a toss-up between eating or buying medication, which, again, for any of us that, those are things that are not, shouldn't be happening in the world that we live in today. And it's incumbent on us in this room to try and improve the lives of those that are vulnerable as best we can, and understand it is a challenging job for government. But again, it does not negate the fact that, my role as the opposition critic is to question, the ministry and why they're putting money where they're putting it, and making sure that we're finding out that it is in fact the best way that we can support those different vulnerable populations. So with that being said, I'll probably have some, further remarks. I think we only have a very short time. Just a few short hours, so I will get started. And I did start off in my kind of quick opening remarks here, talking about food banks. Again, I have had the opportunity to visit numerous food banks across the province, and I do want to give a shout out to, I had the opportunity to visit the food bank here in Kamloops and Kelowna. The unbelievable work that they are doing. With the limited funding that they are receiving. I think one of the things that I found most amazing is the food diversion programs that all of these organizations have done. And, the hub model where, they recognize that small communities just don't have the ability to, to support their communities. So, these larger centers, Kelowna or Prince George as well, Kamloops, they become this hub, and they work with, the different grocery stores and, diverting millions of tons of good food that would normally be off to the landfill, and refurbishing it and providing an unbelievable opportunity for folks to access the food bank. The 2023 Poverty Report Card from Food Banks Canada, however, did assign BC with a D+ grade, with food bank visits up 20% between 2022 and 2023. Despite an expected 18% increase in demand for nonprofit services, which translates over 1 million new visits expected in 2024, the Food Security Initiatives program has received no funding in the 2024 budget. Could the minister explain why this program was overlooked, especially given the unprecedented need across the province.
Minister.
Thank you, Chair. I'm going to give my friend the quickest answer, and I know that we'll be able to speak in more detail about that, but that's because the last fiscal year, we gave 2 years of funding at once. So everybody knew 2 years of funding, and that was given at the end of March 2023.
Member.
Yeah, thank you, Chair. A study of 1,400 nonprofit organizations, and I do thank the minister for that. However, it still poses the question that there was a study of 1,400 nonprofits by the Second Harvest Group that states that food banks, charitable and nonprofit organizations need an average of $76,000 to meet the anticipated demand for services in 2024. Many food banks across BC have expressed concerns about having to turn people away seeking food or struggling to keep up with demands. So the reality is that these organizations are still short. The reality is the affordability crisis, inflationary costs, and all of those costs continue to skyrocket beyond the reach of many people. So again, can the minister explain how these organizations that are so critical in feeding British Columbians who need to support and rely on, who need the support and rely on them, are supposed to manage in 2024 with no funding, considering the consistent predictions of increased demand, not only in 2024, but projected to go on and on?
Minister.
Thank you, Chair. So I'll just read into the record for the member. This is the 2 years of funding, last year and this year, that was given to food serving organizations in light of the intense pressures, the terribly increased cost of food because of global inflation, more people going to food banks than what we were hearing from them directly. And so that was, I'll break down the 50 million that was for last year and this year. We gave 15 million to local food banks for direct support. This is a bundle that we gave to Food Banks BC for them to distribute to member organizations across the province, and them knowing who is in the deepest need and what was the best way to get the money out the door the most quickly. That was for this bundle of needs: local food bank direct service delivery, rapid access to food during events like wildfires, particular focus on northern communities for which the cost of food and transportation challenges were particularly intense. That was all the 15 million to Food Banks BC. We also gave $15 million to a fund administered by the First Nations Public Service Secretariat. That was the First Nations Wellbeing Fund, and it funded many projects related to food security. We also funded $14 million. We gave that money to United Way BC for them to then adjudicate to organizations that applied for investments in food security infrastructure. Another fund that we asked United Way BC to take on was $7.5 million to expand local food hubs, which I can speak to in more detail if the member wants to pursue it. And then separate from this 50 million, we also administered in 2023, $90 million to not-for-profits, and then the year before, 30 million to not-for-profits, and a good number of them would also have applied to that fund administered by the Vancouver Foundation for food security initiatives.
Member.
I appreciate the response from the minister, and I certainly recall canvassing questions around the food security program that was introduced, late, about a year ago now, I guess, roughly. Understanding at the time that food, these different agencies, were told that you're going to receive 2 years in funding right now, and then realizing that the inflationary costs have still not stopped increasing. I mean, you could probably say we're 15 to 20% increase in just the cost of doing business that we've seen in the last 18 months. We continue to hear agencies across the board, not only dealing with just food banks themselves, but dealing with the social service sector that are struggling to keep up with the demand. Every food bank that I've talked to, it's increasing use by youth, increased youth by seniors. Another disturbing trend is increased youth by double income, middle income families that just can't quite get through the month. They need to supplement that last week with food banks. That was something that food banks have never really seen before until just this past year. So there's a lot of changes that have happened just in 1 year's time since the minister and I sat in whatever room we were in having this discussion. So the reality is food banks are struggling to keep up with the demand. Whether or not we talk about the monies that were allocated last year for the next 2 years, there is still a significant shortfall, and alarm bells are being rang by these different organizations. BC Food Bank's report card states poverty rates in BC remain above the national average. And again, this is due to the high costs of housing in British Columbia and the high costs of consumer goods here in British Columbia. So with all of these things, and we talked about this last year, we talked about this actually, the minister and I have had this conversation, I think the last couple estimates, this inflationary cost has been progressing. So I guess two pieces. Can the minister provide some hope today to these organizations that are saying, we need help? Because when we see there's only been a 10% increase in the SDPR budget, with all of these other pieces coming down, there's a lot of concern by these different organizations that they're going to be left out dry. And it's even compounded worse because so many of these organizations rely on donations by people, and those donations have dried up because people just don't have the extra food to donate or the extra money to donate. So it is a real concern. So I'm just wondering if the minister can provide today some assurances that there is something in the plans to help supplement and support these different organizations.
Just a reminder to members to please ensure your ringers are turned off for this. So if your ringer or your, the buzzer on your phone or whatever's on, please silence your phone. Thank you. Minister.
Thank you, Chair. I'll remind the member that this was a historic investment that came out last year. There's never been so much provincial support for food serving organizations. Also encourage the member to consider a conversation with the Agriculture Minister, because at the same time that the Premier and I announced this $50 million for food security organizations that doing direct food delivery, there was at the same time another $150 million that was bundled together with that was announced by the Agriculture Minister. That was in direct response to the very alarming atmospheric river floods, the interruptions in local food supply, the interruptions in access to food from the States. And so that $150 million was a food security investment that was focused on BC growing and those other elements, some agriculture elements of food security. But I will also flag of the SDPR funds that I had listed before, for organizations that haven't yet applied. The most recent round of funding just opened on April the 8th and is open until the first week of May. The first week of May. So there is still an opportunity. This is part of the critical food security infrastructure, part of last year's $50 million investment. And so the idea is, and what we heard very closely from the sector, is that in many cases they receive donations of food, as you noted the member noted in his opening comments, the donations of food from major grocery chains, from warehouses, food shipping companies that will sometimes decide that it's much easier for them to deliver a tractor trailer to a food security organization than it is for them to go ahead with their original delivery, or they just want to clear out the whole commercial truck, at a very large scale, whole containers in some cases, so that they can carry on with their other operations. For local organizations, food security organizations, to have the capacity and the infrastructure to be able to receive those donations is extremely important. In my own community, I learned so much from Loaves and Fishes in Nanaimo. The executive director there, Peter Sinclair, says there is not a food scarcity problem, there's a food distribution problem. And some organizations, as the member noted in his opening comments, have really embraced that concept. And so for this part of our funding that just applications just opened on April the 8th, it's more focused on the smaller infrastructure. So this is not a food security organization building a new warehouse, but the walk-in freezers, maybe the refrigerator truck, that sort of scale. And so if the member knows organizations that he's been speaking with, then we're very happy at a staff level to help guide them through the application process. And again, very grateful to United Way BC for administering that fund on our behalf.
Member.
I do have this question later, but I think I'll canvass it now because the minister just spoke about it, and that is the $50 million from last year, the food security fund that went to Food Banks BC and United Way. I'm just wondering if there is an accounting of those funds and I know we're just at the end of fiscal year, but if there's an accounting or a bit of an update that we can get to where those funds were actually broken down and what they were utilized for.
Minister.
Thank you, Chair. Two ways of answering the member's question. One, the breakdown of where the monies were to be directed, I've already read into the record. I think what the member's asking is about to which organizations and which amounts the money was dispersed by each of those large organizations. The contract that we wrote with them had a reporting date of April 30th, so that those reports are not yet in our ministry's hands. I will add one item, though, to the member's previous question about money that has not yet flowed to organizations. Although applications have closed to the First Nations Wellbeing Fund, granting decisions by the First Nations Summit Secretariat, Public Service Secretariat, are just being made now. That's 95 nations that we expect to be funded, and the money will be going out this summer. And so said another way, the benefit of that particular fund hasn't yet been realized in communities, but the money is, will soon be dispersed.
Member.
Thanks, Chair. Thank you to the Minister. And I guess, I know it was read into the record where the money was put out to. But I guess what was the accountability on behalf of the organizations to report back to the ministry in regards to, where the funds were, and maybe you haven't got that back yet because it's that time, I don't know, but, administrative fees, what were, did it go to purchasing, X, Y, or Z? So I'm just wondering if there's a bit of an update on where it actually went and how it was spent.
Yeah, so I'll just repeat.
Sorry, Minister.
Sorry. Through you, Chair, I'll just repeat again that the responsibility of the organizations was to report to us April 30th, and so those reports have not yet been received.
Member.
Okay, I was just hoping for a bit of a pre-update, maybe that there'd been some preliminary reports. So that's kind of what I was hoping for, but I guess not. We'll have to ask this question. Well, hopefully not ask this question next year. We'll play that one out with the crystal ball. So again, according to Food Banks BC, 1 out of every 3 food bank users, and I alluded to this a little earlier, and 1 out of every 3 food bank users is a child in this province, and the number of seniors accessing our food banks is over 20% increase over the past couple of years. I also talked about, again, those middle income families that are also struggling. But can the minister discuss what is being done very specifically to help out those vulnerable communities with children and with our seniors specifically to manage and deal with this inflation and rising costs?
Minister.
Thank you, Chair. I'm going to start general because, as the member knows, the poverty reduction strategy is a cross-government initiative, and the way that we were able to exceed our legislated targets was not just, although SDPR holds the poverty reduction plan, it's a cross-government initiative that actually brings in supports particularly for children and seniors. Examples would be increasing the BC family benefit, expanding $10 a day childcare, adding an extra $20 million to the Student and Family Affordability Fund to help schools provide support directly to families for student necessities like school supplies, taking action on a whole range of affordable housing, sometimes which is targeted for families, sometimes which is targeted for seniors. And I can talk in more detail about that if the member wants to go into it, but I will work not to get into the specifics of programs that are delivered by other ministries. But I will talk just a little bit about the specific supplements that my ministry delivers, both for seniors and for children. But I'll do this kind of quite briefly and then welcome the member expanding with further questions and certainly go into it more deeply. So as the member knows, the majority of income support for seniors is provided by the federal government. So someone who is on income assistance or disability assistance, when they hit 65, then they graduate, so to speak, to federal supports. But a specific program that my ministry delivers is what we call the Senior Supplement, which tops up federal income supports for seniors for the reasons that the member cites. That supplement had not been increased under the previous government. We doubled it, and we helped it reach 20,000 more seniors by expanding the criteria. It now reaches, the senior supplement, 2023 reached 96,000 seniors, 290. So that's 96290 seniors. The seniors supplement, the maximum monthly rate is $99.30 per single person and $220.50 combined for couples. So that's on the direct SDPR supports that are specifically directed to seniors. Something that was increased last year, implemented over this past year, was a school startup supplement. It's provided to recipients to assist with extra costs associated with schooling for a person under 19. We increased the school startup supplement and child's age eligibility from $100 for a child age 5 to 11 years to $120 for a child age 4 to 10 years. And we increased it from $175, which was for a child age 12 plus, to now $210, and we made the start age 11. And again, very happy to talk about other programs or go into those in more detail if the member wants to pursue.
Member.
Yeah, thanks. And I'm going to break away from there just because I do want to give my colleague from Caribou North does have a couple questions that I'd like to have her sneak in, and then we can come back to this again.
Thank you, recognizing the member from Caribou North.
Thank you very much, Honorable Chair. And through you to the Minister. Yesterday, we celebrated Construction Month. Well, we celebrated all April long. And several of the people in attendance are part of Women in Trades. And one of the concerns that's been raised, not just by this group, but by multiple groups in our offices, is about a sudden cancellation in program for Women in Trades programs. I recognize this may be part of workforce development agreements, so there may be something connected to the federal government. So twofold, is there an update on that we can share with people that are connecting with our offices? And I guess the second piece, if I may, and it might be a renamed program. We used to call it the Single Parent Initiative, where we would provide training for an individual. Often it could be a single mom who wants to go and access training, and then we provide that wraparound support for that individual from training to childcare, transportation, and all of those pieces. And I know that a lot of the people that used to participate in the Single Parent Initiative would take, for example, the program Women in Trades. The person I met with yesterday was one of those individuals that utilized that to put her on a path towards that training. So if there's an update that perhaps I could get, thank you.
Minister.
Thank you, Chair. So the Women in Trades program that you describe, that the member describes, I would recommend that the member canvass with PSFS. Both our ministries receive federal funding for employment services under the LMDA that I described in my introduction, but that particular program was, and it's largely the funding comes to my ministry, and so we can certainly talk about some of the really innovative programs along the lines that you described, but that particular program is one that is part of the funding that goes to post-secondary and future-ready skills. And so we're certainly happy to give them a heads up that you want to canvass that with them directly. But lots of similar kind of programs that we do fund, and a lot of really positive stories about our ability to link people, support people with new training, and then get them connected to employers just in the way that you describe. We do have, okay, so that's like the end of my answer on the Women in Trades program. In response to your question about the single parent, in response to the member's question about the Single Parent Employment Initiative, we do have that program still. It provides eligible single parents on income assistance or disability assistance with increased supports to find and keep a job. We make those linkages through our Work BC programs. It provides up to 2 years of training for in-demand jobs or a paid work experience placement while remaining eligible for income assistance. Childcare costs are covered while participating and through the first year of employment. Assistance with transportation costs is covered while participating. And the Single Parent Employment Initiative participants are more likely to be employed in occupations typically requiring college education or apprenticeship training. This is funded both through the SDPR side of the federal LMDA funding, but also with direct provincial funding. Results that we have in this area, as of December, 1,856 clients found employment in a variety of in-demand occupations in sectors like retail, health, construction, community service. Just over 79% of participants had an employment outcome, compared to 31% for those who did not participate.
Member.
Thank you very much, Honourable Chair. Through you to the Minister. Has there been a significant change then in the federal funding formula for the labour market development agreements? Or is it, like, did it end? Is there some significant change that's happened in the last month that would cause a significant ripple effect into programming in other, I guess, in your ministry and different public partnerships?
Through the chair.
Through the chair.
Yes, thank you. Minister.
Thank you, Chair. So to the member's question, I'm going to speak to my own SDPR programs, not about the Women in Trades program, which is under PSFS. We are waiting eagerly for the federal budget to come down, which is going to come soon. The member will remember that some say in the 90s, certainly this was formalized in 2008 or so, that the federal government moved its budget and a lot of its staff that were doing employment training supports from the federal government to the provinces and territories. Ordinarily, we would have heard about what is described as the top-up in the spring, and we still haven't heard. All of the provinces and territories expressed to our federal counterpart, and he shares our concern and recognition that for us to have real confidence, we really we're waiting for the federal budget, and we wish that we'd heard last spring. But so there is some uncertainty about when that money will come or whether it will be in the budget. But I'll say for our own ministry programs, it hasn't had any impact on our service delivery. But if the federal budget doesn't go as we wish, then that will be a different question. I'm certainly happy to keep the members apprised of that. No impact on our programs in SDPR, and we are really hoping for a positive answer in the pending federal budget.
Member.
Thank you very much, Madam Chair. Through you to the Minister, we certainly hope we'll hear good news. So I guess my final question, because I don't want to take up any more of my colleagues' time, and I appreciate this. So if there is no impact in any of the programming that your ministry has had, I guess as we head into the public or post-secondary estimates, how have you been able to keep all of your programs whole, where we're seeing other programs that have all of a sudden in the last couple of weeks have had to cut their programs because they don't have the confidence that the money will be there?
Minister.
Thank you, Chair. I encourage the member to take this up with PSFS. I could go into a lot of detail about how we structure our grants and our training contracts, but I don't think that's what the member wants to know. And if my opposition critic wants to canvass that, then we've really got a lot of extremely encouraging and positive examples of the kind of ways that we can train people for better paying jobs. We've had a lot of really good outcomes, but I don't think that's probably really going to help the member with the question that she has about the program within her own riding. And I'll certainly alert my colleague in PSFS to be ready for that question when her time and estimates comes.
Recognizing the member for Peace River North.
Thank you, Chair, and thanks my colleague for asking her question as well. Just kind of wanted to go back, as we were canvassing before that, just back onto food banks and some of the struggles and challenges that people are having. And, I recognize that, the ministry has added some new money. The minister, reminded me of the historic increases or investments, as well as talked about the $49 million, not 50, but $49 million food security program that was invested in last year. But I want to come back to the realities that are out there. And, when we're talking about, and I've got, you just got to go through the news articles and find out the struggles that different food banks are facing. The Victoria Food Bank, talking about unemployment rate flat. Many folks that have never had to use the food bank before are now accessing the Victoria Food Bank. They're worried about being able to keep up with the demands. Surrey Food Bank is going broke as demand surges. And that's just a news story from a few months ago. Again, the Surrey Food Bank struggling with donation deficits as demand is skyrocketing. Again, worried about the ability to keep up. So that's the reality since last year when we did our budget estimates. Things have got worse. And people are looking to this ministry, which oversees Food Banks BC and supports for vulnerable people, for hope, for lack of better terms. They're looking for supports because, and these are only two. There's many other news stories about food banks, even up in my own area, up in Fort St. John, increased food bank usage, and it is across the province. So I asked the minister a couple questions ago about being able to provide hope or some sort of, I guess I'll just leave it with hope for these organizations that are looking to the ministry to be able to continue. And not a list of what was done last year, but I really think we need to have that ability that they can lean or at least have somewhere to go within the ministry to get the supports that they need to be able to continue to look after our most vulnerable population. So again, I asked the minister, plead with the minister, if she can provide some of that hope today for these organizations.
Minister.
Thank you, Chair. I have already listed for the member the two programs, one that just opened for taking new intake applications on April the 8th. I've also, which is administered by United Way BC. I've also mentioned the First Nations Wellbeing Fund, which has a lot of food security initiatives within it, where the money has not yet flowed. I believe I said 95 First Nations organizations that we expect to be funded. I have already reminded the member that the funding lasts until the year 2025-26. It was 2-year funding that was provided, and it was a historic, well beyond the cost of inflation, well beyond the rate of inflation. The expansion of food security funding last year, there's never been so much that has flowed. There are a few other examples of where we have spent the money. Again, this is not new funding for organizations. They've already received it, but in case the member hasn't heard from them directly, we funded Langley Meals on Wheels, $350,000. That was support for elevator accessibility infrastructure upgrades to ensure inclusive access to food programming. We funded Immigrant Link Center Society $300,000 to build on really innovative practices that are supporting food access for immigrants, refugees, and newcomers. I can get the member more details if he's interested, but I believe that it expanded food distribution to, I think, 5 new centers and added more days of week of access, again in response to the expanded need. And it's a really innovative and really inspiring program. I loved meeting the principals there. To Cloverdale Community Kitchen, we funded $44,000. That was for the purchase and installation of a commercial dishwasher and a walk-in cooler to maintain and expand the existing food programming to waitlisted community members. And we've got many more examples like that, where we really tried to keep the funding really open. The food serving organizations named the needs that they had. And I will just correct the member, I think it might have been inadvertent. It's not that my ministry oversees Food Banks BC, it is an independent organization, but that in this case we recognize Food Banks BC's expertise and that they could deliver our funding more directly and more informed by needs on the ground. And so we granted them the funds, they then in turn distributed it on our behalf. But we're grateful for their work, but we don't control or oversee them.
Member.
Yes, and through the chair, that certainly was not what I certainly meant to say, and obviously do support Food Banks BC and the incredible work that they're doing with what they have. I guess maybe to go back to my previous question and to specifically ascertain if the minister did talk about this April 30th, I think it was April 30th deadline to apply for these funds. My question is that 2024 budget dollars, or is that previous year's budget dollars?
Minister.
Thank you, Chair. So the member is referring to the funding that we gave last year to United Way. It is a fund which opened on April the 8th. It's for this next month doing intakes. It's in the small food security infrastructure category. So again, not somebody that is going to build a warehouse. That fund has already been delivered. This is on the smaller side, say a refrigerator truck or a walk-in cooler, that kind of thing. And any organizations that are interested in applying can talk with United Way BC directly. Opened April 8. We think it closes May 8th, let's say, to be conservative. And that funding is available to organizations to apply for.
Member.
Thank you, Chair. So I guess, this kind of is leading me to my questions and why I've kind of been going along this line of questioning regarding, we know things have got worse. We know that more people than ever are struggling, more people than ever, or more people than, are accessing our food banks. It's chaos out there. In the 2024 budget, what monies are earmarked for supporting our vulnerable people that are in these situations that I've described to the minister, that are struggling, children that are, needing to access food banks, seniors that are needing to access food banks? What is in the 2024 budget that is new and improved that people can look to and help alleviate these challenges?
Minister.
Thank you, Chair. In last year's budget was where we funded the 1, 2, or 3-year funding to food security organizations. Depends on the budget, on the pool of funds, and I listed those right out at the outset, so I can go into those details with the member if he wishes. So in some cases, the money from last year's budget lasts as long as the years 25, 26. What the member might also be alluding to, again, from last year's budget, but a permanent increase, a number of health supplements and food supplements that are available specifically for SDPR, income assistance and disability assistance clients. Those have all increased after some years of having been frozen, and so I can go into those details with the member as well. And again, I'm interpreting his question about being just about food delivery, but if he wants to talk about other forms of income supports and other expansions of the budget, then I certainly can.
Member.
Okay, thank you, Chair. Thanks to the Minister for the response. I guess maybe then which just might make it easier for the questions, and if I can get confirmation on that. And I recognize the minister keeps referring back to what was done last year, what was done previous years, committing to, a few things moving forward, whether we're talking, food supplement, programs that were established previously. My question, if I could get the answer, is, and I guess I'm to assume, Honourable Chair, that there is no new money in the 2024 budget that is dealing with the incredible increase of people seeking need from food banks and people seeking supports, our vulnerable people seeking supports. Can the minister confirm that there is no new 2024 money that is supporting these needs?
Minister.
Thank you, Chair. Understanding the need, as the member has alluded, we felt as a government it was important to provide multi-year funding to food banks, just for the reasons that the member states. Again, it was $50 million, and multi-year funding so that organizations could have the confidence and security about being able to do multi-year funding and be able to operate on that basis. So I think I've answered that question in a couple of ways now. There is funding right now for food banks, and there's some of it that is still going out the door, and we're very grateful for the work that they are, the fact that they are putting fresh, nutritious food in people's deepest time of need. It's extremely important. We're very thankful and reliant on their partnership.
Okay, last question, member.
Yeah, okay, so yeah, just following up on this, and I believe it was $49 million, if I'm correct, that was allocated, unless there was $1 million found somewhere over the last year since we spoke about it. But and the minister, the member alluded to these challenges. Well, I'm not alluding. We've got multiple, and I know that organizations have reached out to you. It's not alluding. It's very factual. People are struggling. People are accessing food banks more than ever. Groups, demographics that have never accessed food banks before are accessing food banks now. It's very dire. And I'm a year ago when the minister, the ministry was making these recommendations to do something over the next couple of years. I'm not saying they were bad, but they're not enough now. And this is what we're hearing. When you have food banks talking about closing, organizations, not-for-profit, we've leaned so heavily on our not-for-profit sector in the social service side that they're done. They don't have the resources. And I find it really interesting that it doesn't sound like there is specific new money, other than the couple programs that you did mention, that is going to, we've identified these are new challenges in 2024 that we're facing today. There's a little, wherever the money is, I'm curious why there wasn't something set aside as an emergency fund, knowing that things are not getting better, certainly anytime soon. Why there's no emergency something fund or something in the 2024 budget that's going to support these food banks that are on the verge of collapse. And I guess I'm asking this question again in a different way. New monies supporting this new critical issue Is there anything there?
Minister.
Thank you, Chair. To repeat myself, we can't control the cost of food. We can put more funding in the hands of organizations that are feeding people. We saw the need. That's why we funded it. $50 million, multi-year funding. It is still going out the door. It is still available to organizations that apply to either United Way or Food Banks BC. With that, Honourable Chair, I move that the committee rise, report resolution and completion of the estimates of the Ministry of Labour, and report progress on Ministry of Social Development and Poverty Reduction, and ask leave to sit again.
Okay, members, the question is that the committee rise, report resolution and completion of the estimates of the Ministry of Labour, and report progress on the estimates of the Ministry of Social Development and Poverty Reduction. Seek leave to sit again. All those in favor, say aye. Aye. Any opposed? None. Motion's carried. Thank you, members. This committee stands adjourned.